Welcome to Formosa Dream Chasers.
We're your hosts, Mary Anne
and Ching-en.
Please join us as we explore the journeys amazing people take in pursuit of their dreams.
And get insights from their experiences.
Let's hit the road.
And get started.
Hello everyone, this is Mary Anne Sioco and welcome to Formosa Dream Chasers, a show about ordinary folks who have stepped out of their comfort zones and have taken a chance on themselves, on their passions, and on their dreams. Today we sit down with Dr. Henry Wu, a board-certified family physician and one of Taiwan's leading voices in preventive medicine, anti-aging medicine, and bioidentical hormone replacement therapy, also known as BHRT. We'll explore his journey into functional medicine and discuss some of the most debated topics in modern healthcare, where we'll be discussing anything and everything from leaky gut and chronic inflammation to menopause, testosterone, and the future of longevity medicine, given his work on helping patients uncover the root causes of chronic health issues, optimize hormones, and improve gut health, prevent chronic disease, and extend health span through a personalized, science-based approach. Okay, that was kind of a long introduction. But definitely welcome, Dr. Wu, and I'm happy to have you on the show.
Hi, Mary Anne. Thank you. It's a pleasure to be here and sharing the topics that you just talked about. It's a very important topic, and probably for people, it's like every day they talk about or face a lot of health issues, and there are a lot of important concepts and topics that we will talk about today. So yeah, it's a great pleasure to be here. Thank you for inviting me.
Thank you also for making the time to share with us your journey. So before we start tapping into your expertise, perhaps let's start a little bit with your background. Do you mind sharing a little bit about yourself with our audience? Like, what first inspired you to pursue medicine?
Yeah, so I was trained at the National Taiwan University School of Medicine, and I'm a board-certified family medicine physician. So I did my clinical practice at a community clinic and seeing patients almost every day, diagnosing disease and prescribing medications for them to control their chronic diseases, hypertension, diabetes, high cholesterol issues, and day after day, months after months, years after years. And someday, some questions hit me, and it made me wondering, did I really make them feel better? Did I really make them getting healthier? Because, the conventional healthcare system, everybody has this experience that you go to the clinic or to the hospital and tell the doctors your symptoms, and the doctors diagnose you with some kind of disease probably, or they prescribe medications to you to treat your symptoms. But after years of practicing like this as a family physician, I wondered, is this all about health? And I think that health has more dimension. It's not just about diagnosing and prescribing. There should be more dimension. For example, people want to prevent disease. They want to feel better. They don't want to be diagnosed with some specific disease and then get all the prescribed medications. They want to prevent disease in the first place. They want to feel better. They want to even promote their health. So then I start to look for other information to see how I can help people really feel better. Because, well, if you think another way, if I really make people feel better and get healthier, they should take less and less medications,
Right.
not more, right?
Yeah.
And they should come to see me less often. So, right?
Yeah.
So it's like doctors diagnose disease and prescribe medications, of course. But if I can make them feel better, if I can make them get healthier, then they don't have to come to me. So I start to look for all these informations, all these medical educations. And then that's why after seeing patients for years, I started to learn this functional medicine or the preventive medicine or anti-aging medicine. And finally go into this BHRT field because I want to look at the health and the disease and the chronic symptoms from other angles and try to help people to tackle the problems through a more complete, a more holistic approach.
I understand that you went into functional medicine because you were searching for answers in terms of providing better health care. And for people who still are not familiar with the term functional medicine, how would you explain this to them?
Well, most people are quite familiar with conventional medicine. You go to the doctor and the doctor may do some tests and they may diagnose you with some kind of disease and then prescribe medications to you to treat your symptoms or your numbers. Well, functional medicine, it looks at the chronic symptoms and chronic diseases from another angles. It expands the lens. So, for example, the conventional medicine may treat the symptoms, but if you have a chronic problems, you have chronic diseases, chronic symptoms, the functional medicine try to look for the root cause of it. So the same problems, you may have different approach. You can just suppress the symptoms with medications, but you can also look for other root causes if the symptoms persist. Nowadays, a lot of people, they have chronic diseases, diabetes, hypertension, cardiovascular disease, or high cholesterol problems. You can take medications to control the numbers, but you can also look from other factors, the possible root causes, to address the problems. So functional medicine, it expands the whole lens. It looks at the same problems from different angles. So it's not replacing the conventional medicine. It actually makes medicine more complete and thorough and holistic way.
I see. So would I be correct if I were to say, for example, with conventional Western medicine, if I have a cardiovascular disease, I would go to, let's say, a heart doctor.
Yeah,
but
a cardiovascular doctor, yes. Yeah.
Right. But with, let's say, with the functional medicine approach, I would go to a doctor like you, but then you would not look at my symptoms merely from the cardiovascular disease. You would also look into the other aspects of my health to see what are the, I guess, triggers that would cause my particular problem. Would that understanding be correct?
Yeah. So usually the functional medicine, we know that chronic disease usually it doesn't happen overnight.
Right.
It takes times. It takes years, even decades. For example, the cardiovascular disease or the dementia, it takes decades for the disease, for the symptoms to appear. So when you go to the doctor, usually people, they feel symptoms, the disease symptoms appear, they go to the doctor and get drugs. But we want to prevent the process in the first place. It's years before the symptoms appear. So usually there are some signals, there are some clues, or there are some loss of function that signal us that something is going wrong. So functional medicine, usually you start with the loss of some function before the disease is diagnosed. So functional medicine try to look for the possible root causes of chronic diseases and chronic symptoms and try to adjust all those factors. It try to correct the pathway so that your body, your health can go on the right track.
Okay. You were sharing earlier in your journey as you were practicing medicine, you noticed that there were a number of diseases that didn't seem to get better, if I can use that term loosely. And what do you think are the most common diseases and perhaps like the usual overlooked root causes of chronic illness today?
Well, nowadays, if we look at the top 10, the major causes of death, usually it's cancers, cardiovascular disease, and cardiometabolic related disease like heart attack, heart disease, diabetes. So a very important root cause of all the disease is inflammation, chronic inflammation. Well, a lot of diseases is caused by the chronic inflammation, and insulin resistance usually is the culprit that is driving the process of the chronic disease. And nowadays, all this chronic disease has a lot to do with the lifestyle factors, the diet, nutrition, the exercise, activity, the stress, and the sleep. And of course, environmental toxins also play a role, and hormonal imbalance also play a role. So for the preventive medicine or anti-aging medicine or functional medicine, whatever we want to call it, all this chronic disease, the lifestyle factor play a very important foundation in it. And we have to address all these different factors to make ourselves feel better, function better, and to prevent the chronic diseases in the future. And there are always something we can do to address them, to prevent us from getting the chronic diseases.
Okay, I understand. And speaking of chronic diseases, I know that you specialize in gut health and also BHRT, Bioidentical Hormone Replacement Therapy. So I would be interested to learn more about this in addition to your functional medicine practice. Could you tell us a little bit about leaky gut? What exactly is this?
All right, so leaky gut, well, probably some people heard about leaky gut and think it's a kind of a fancy term. So medically, the term is called increased intestinal permeability. So, all right, so we can think gut is just like a pipe, it's a pipeline. So the gut is not just for digestion. And within that pipe, there's a coating, there's a lining inside it. It's a one cell thick lining. And all these cells, it sticks to each other hand to hand. It's a very important, well organized, and dynamic filter. It's just like a filter that lets all the nutrients and healthful substances in through our body, and it keeps away all these harmful chemicals, toxins, or harmful microbes. It prevents them from getting into our body. So this filter is so very important, but well, there are a lot of possible factors that could damage this lining. When this lining is injured or damaged, it forms kind of a leaky filter. So that's called increased intestinal permeability, meaning that the filter does not function as it should be, and a lot of harmful microbes or toxins or undigested food substances can go through the filter into our body, and that may trigger our immune system to fire. And when our immune system fire in the wrong direction, in the wrong way, it will lead to inflammation. And what's interesting about leaky gut is that a lot of people think that gut issues may cause gut symptoms. Yes, of course. But what happens in the gut does not stay in the gut. Because the inflammation, it may lead to systemic inflammation, so it may affect the overall body from your brain health to your heart, to your vessel, to your immune system. So a lot of recent science shows that if you don't have a healthy gut, it may relate it to your brain health, to your cardiovascular disease, to autoimmune disease, to diabetes, to even allergy, of course the gut symptoms as well. So as the ancient Greek physician, the Hippocrates, who is regarded as the father of medicine, said, all diseases begin in the gut. So gut health is very critical. If you don't have a healthy gut, you may have symptoms other than the gut symptoms. You may have other health issues, health problems, even metabolic issues.
Okay. And how do you evaluate a person's gut health in your practice?
Well, usually I start with a story. I listen to the patient and how they feel, what symptoms they have, and their symptoms, their past medical history, their lifestyle, their nutrition, their exercise, their stress, and their sleep, and also the medications they take, etc. Sometimes when you listen well to the patients, They are telling you not just their story, they may be telling you the answers. So when I discuss with the patients, when I talk to them and listen to them, well, of course they may have some gut issues, gut symptoms, but a lot of symptoms may be related to the gut issues. So when they have a lot of chronic symptoms all over the body, and especially if they have the gut discomforts, gut symptoms, usually gut health is a very critical issue that we have to evaluate. Of course, there may be some tests that we can try to do to evaluate their conditions, their status, but the test is for guiding our decisions and our management. And history taking and their symptoms are always a very important indicator, a very important clue for us to diagnose their problems.
I see. And, you know, when people think of gut health, I think most of the time they correlate this to probiotics because they think that maybe just taking probiotics would help with their gut health. What would you say about this?
Well, gut microbiota is very important, of course. You know, there are maybe not just millions, probably trillions of gut microbes that reside in our gut. So gut microbiota is now a very popular, a very common science study subject. And so people may see a lot of, variety of different probiotic supplements on the market, but there are a lot of factors that play a very important role in gut health. Your diet, your nutrition, your activity, exercise, your stress management, and your sleep quality, and even the toxins, they all affect your gut health. So it's not just about probiotic supplements. Well, I should say there is no one specific supplement that can outperform a poor lifestyle. You know, so lifestyle, I always emphasize, lifestyle is always the most important foundation. Well, besides all the supplements or treatment or medications, whatever, lifestyle is always the most important foundation regarding the long-term health. So you have to take care of your nutrition, of course, exercise and stress management, and sleep well so that you can have a healthy gut. But of course, you can evaluate and maybe do some tests to see if you have some specific nutrient deficiency, to see how you can adjust your diet. And if needed, you can take some supplements. But supplements is to support the foundation. It does not replace the foundation.
Okay, and the foundation would be making sure that you have generally healthy lifestyle. The different factors that you mentioned earlier, would that be correct?
Yeah.
Okay. And then since we're talking about some myths or wrong ideas when it comes to gut health, what are the other common misconceptions do you hear when it comes to gut health?
I think a lot of people, they probably don't associate gut issues, gut health, with other health issues. But for example, brain health, metabolic syndrome, metabolic disorders, cardiovascular disease, even diabetes, autoimmune disease, actually they are all related to the gut health. So that's why we mentioned that all disease begins in the gut. So it's very important to correct your gut problems before, a gut problem is critical. So you have to have a healthy gut before you're addressing other problems. Of course, you can address all the factors at the same time, but usually you cannot neglect the importance of the gut health.
That's all for part 1 of our conversation with Dr. Wu. Today we learned that true health isn't just about treating symptoms. It's about looking at the whole person, with gut health playing an important role to long-term wellness. In our next episode, we'll talk about one of the most talked about topics in modern medicine, bioidentical hormone replacement therapy, also known as BHRT. So be sure to join us on Formosa Dream Chasers next week.
This is Ching and Cho
and Mary Anne Sioco.
See you guys next week. Bye.